A lot of people right now, they don't even understand how serious it is, the fact that we have children and families of our own, but yet every day we have to go out there and take care of people that could possibly put our lives and our health at risk.
Guys, welcome back to Be Divine Minded. It is your girl, Goddess Fumi, or you can call me Jennifer because that's what my mama named me. Now, today I wanted to talk about the lovely and wonderful and exciting career of nursing. I have been in the medical field since 2006. I started out as a home health aide, and then I became a CNA in 2008. I then became an LPN in 2012, and then just recently, 2018, I actually got into the RN program. I did a year and a half of my prereqs and then did the first semester in the actual nursing program. A lot of things that happened in my life, so I took a break from the program, and I'm actually contemplating if I really want to go back, seeing as though as an LPN, I am literally doing everything that an RN would be doing, just getting a few bucks short. With more money comes more responsibilities, and that is why I decided that I'm gonna make this video today on 5 things that you need to think about before you actually get into nursing, before you actually just choose that career or any career in the medical field, especially nurses. Because one thing that people don't realize is that in any setting, in a hospital, a nursing home, a clinic, nurses can pretty much do everyone else's job, but no one else can do the nurse's job, okay? So let's get to the video. So number 1, you are forever a student. No matter how long and how stressful nursing school was, once you're out on that field, that is when the real learning begins, okay? Like actually having to be responsible for these patients and having to keep up with the pace, especially if you're working in emergency rooms or, surgical centers or dialysis centers. Like you have to be able to keep up. There is such a high demand on nurses because a lot of people aren't able to keep up. Just because you're graduating, you got your degree, that does not mean that the schooling or education part of nursing is over. I mean, we have in-services almost every other day. You're gonna have to do these continuing education programs online, and you're gonna also have to come in and do in-services that is required by each state that you work in, okay? You're gonna also have to deal with new medications and new procedures. You're gonna have to deal with new illnesses and the guidelines and the regulations. The more people are suing, the more that you're gonna have to deal with new laws and new regulations and new practices and ways of doing things, okay? So nursing is not something that you're just gonna graduate and do, and that is just gonna be it. No, you're gonna constantly have to learn. And there's so many different specialties in nursing that just because you may be good in geriatrics, that does not mean you're like a brand new nurse when it comes to the ER room or when it comes to like dialysis center, okay? So with nursing, there's so many different specialties that just to graduate as a nurse is really not enough. You have to get that experience and you have to get those specialties under your belt to where I can go in any setting and be okay. That takes a lot of experience and a lot of continuing education. So number 2, with nursing, you have to be patient. You have to learn how to deal with people. Like if you're not a social person or if you're not able to deal with people and communicate with people, nursing is not for you. I don't know how many nurses that I've seen on the floor that is just not made out for this job. Like you have to know how to talk to people. You have to understand that these people are at their most vulnerable state. You can't be talking to these people like they are just in a normal mental state, because when someone is sick, when their equilibrium is off, their health is off, they are not within normal limits. So they're not going to think straight. They're not going to behave the way that you would expect them to. So in nursing, you have to understand that these are human beings that you're dealing with, and you have to understand that they have emotions. They have their own set of principles and ideologies and, just beliefs on everything. So when you are a nurse, you're going to have to understand how to communicate and deal with people and respect their boundaries and respect their culture and their differences, okay? You're gonna have to learn how to talk to them in a way to where they understand. We have to understand medical terminology, but you also have to understand how to speak to people in layman's terms because they didn't go to nursing school, okay? So communication and patience And just having the passion to become a nurse is so important before you step out there and say, hey, I want to go and be a nurse, okay? Number 3, if you are interested in getting into the nursing field, you need to understand that regular shifts that don't apply to you.
Like, it's very rare that I get to work on time and that I'm leaving on time.
For one, you have to wait until the next nurse is there to relieve you, because if you don't and you leave, that is neglect. For most nurses, when you are at work, you are responsible for not only the patients, but you are also responsible for making sure that that shift is ran right, like as far as making sure that there's enough CNAs on the floor, making sure that, the narcotics are safe. If you work in hospitals or nursing homes, a lot of them are getting up to date. We're using the computer now to unlock the medications, but still, a lot of places are still using that key and that medication card. And if you leave, for one, you can go to jail. That is federal prison. You are leaving with the keys to a bunch of narcotics, okay? These are controlled substances. So, I think a lot of nurses don't understand that not only are you responsible for people's lives, but you're also responsible for, narcotics. And you have to really be on your shit as a nurse, you have to. But there's been times when I've been at work and I've had a patient that, they may fall at 2:45 and I have to stay there and I have to put in a report. I have to call the doctor. I have to assess the patient. I have to monitor the patient. I have to do neuro checks every 15 minutes and vitals on this patient. I have to do a body check, make sure that there's no injuries. If there are injuries, or like if they are on anticoagulants, I have to call the doctor, make sure that we're doing everything that we need to do to make sure that this patient is safe, make sure that he doesn't bleed out, because when you're on a blood thinner, you're at risk for bleeding. So these are things that you have to think about. Like, no matter if your shift is over at 3 o'clock, if you are not done, if that patient is not safe, and if there's no one there to relieve you, to take responsibility for those keys and those patients, you're stuck there, honey.
A lot of times there's disasters on the earth, like snowstorms or, power outages. And as nurses or people in the medical facility, you still have to stay there and take care of those patients. You don't get time off. There's no holidays and weekends in nursing. No, people are sick every day.
Again, some of this don't apply depending on like you're a school nurse or if you're working at a clinic. But even then, anything can happen. As a nurse, you are responsible for the health and the lives of the people that is under your care, period. 4. Now, this is one that I kind of was debating on saying, but it's honestly true. You have to understand that your patients is always right. Even when they're not right, they are always right. So you want to make sure that you are doing everything that is on that medication administration record. You are doing everything that the doctor has ordered you to do, because patients lie. They may be confused and forget. A lot of times they get angry with you because you aren't able to do the things that they need and want you to do at that moment. And at the end of the day, it is their health insurance that's paying for them to be there. And 9 times out of 10, a facility, a hospital, whatever, they are going to choose that patient over you. And I do think that it is important for them to advocate for the patients like that. But me being in the nursing field for as long as I have, I understand that a lot of times it be bull crap. A lot of times patients, again, they aren't in their right state of mind and they don't understand the amount of workload that is on nurses and nursing staff. And, they just expect what they want when they want, and they will lie and they will, complain and say things that they don't necessarily understand is hurting that person. And it happens. I've seen so many good nurses and good staff, not be allowed in a room with the patient because that patient just was in a confused state, or just didn't understand what was going on, or just wanted to be spoiled and get what they want. I've also seen good nurses and good nursing staff get fired over the complaints of patients. Some of it is true and a lot of it is not. So that is another thing. When you're in nursing, it's a big responsibility, and it's very good to have good rapport with your patients, because at the end of the day, they are always right. The next thing I want to mention, if you're thinking about getting into nursing, you need to understand that if you don't chart it, it didn't happen. And this is one of the things that I really hate about nursing, because you can honestly be in there from the time you walk in there taking care of patients, sweating and tired, and don't even get a chance to get a lunch break, don't get a chance to go to the bathroom or do anything. You are just constantly working from the time you walk in there to the time you leave. And if you don't chart everything that you did, Nothing that you did on that shift, it does not count and it does not matter, because at the end of the day, it is all about insurance companies and making sure that the facilities or the hospitals is getting paid for the services that they are providing. And these insurance companies are not going to pay unless things are properly charted and properly documented. And then that's another thing, as you do become a nurse, you will understand that there are certain lingo, certain words that you have to use to protect yourself. And it's just like when it comes to charting and nursing, that is really top priority. And that is really one of the things that I hate about it, because I became a nurse to help people.
I want to help people. I want to patch them up, save them, love on them and all that, and then that's it.
I don't want to sit there and chart and literally, if you call a doctor, Dr. such and such, Miss Sally, it has a runny nose. Like, you literally, it's like a whole assessment process. Like, you literally have to chart. You assess the patient. This is the problem. What did you do about the problem? You have to do the assessment, the diagnosis, the planning. You have to do what you implemented, and then you have to go back and evaluate. So it is like, seriously, and all of that is charting. Not only do you have to physically do that stuff, but you have to make sure that you chart. So going back to what I was saying as far as regular shifts, even if you're done with all your shifts, you still have to go back and make sure that you charted everything that you did. If not, it could either be neglect on that patient, because let's say you charted, such and such's blood pressure was 175/90. There's a PRN medication for you to give if the patient has blood pressures over 170. And so you give that blood pressure pill, but you forgot to chart that you gave that pill. Okay, now the next nurse come in, and so she looks at your notes and she said, Jennifer came in and said that this person's blood pressure was this high. Why didn't she give the medication? Even though you physically did give that medication, if you didn't chart it, it's going to look like you neglected to take care of that patient. And not only do you have to chart that you gave that medication, if it's the end of your shift, you're going to have to say, medication given. You're going to have to say, what kind of response is the patient having now? Did his blood pressure go down? What other things that you did to help with that patient's blood pressure? And report given to next nurse. That way they know that you signed him now over to another nurse, because it can always backfire on you. I've also seen nurses charting on things that wasn't even in play anymore. Like, let's say if a patient had an IV for the last 2 weeks and you're just so used to charting that you flushed it. I've come in on a shift and I've seen, like, damn, this person put their IV out last night. How did the day shift nurse flush his IV? So with nursing, there's just so much that you have to be aware of and you have to pay attention to, and you have to just really be on your P's and Q's. Like, that charting shit ain't no joke. And so this is a bonus one, which I feel like it is very important, especially at this time, for me to talk about, with coronavirus going on. Biggest thing with nursing that a lot of nurses have a tough time dealing with is the fact that we cannot choose our patients. I don't care if you're having a patient that has HIV or full blown out AIDS, if you have a patient with coronavirus 19, if you have a patient with the flu, fleas, bed bugs, C. diff, or any other issue that is highly contagious. We don't get to choose our patients. You still have to treat every patient with the same dignity, with the same respect, with the same love and compassion that you will for other patient with just a bruise to his head or a cut on his finger. You have to give the same love and respect to every patient. And a lot of people right now, they don't even understand how serious it is, the fact that we have children and families of our own, but yet every day we have to go out there and take care of people that could possibly put our lives and our healths at risk. We have to always remember our PPEs, our standard precautions, and, just really make sure that we, protect ourselves so that we can also protect our families. Because not every day that people think about the fact that a nurse can be at work caring for someone with the upper respiratory infection or disease. And just because she does not catch it, because she may be immune to it, her family or her young children at home may not be immune to it. So she can easily pass that infectious disease from one of her patients on home to her family. So that is a big thing. I know a couple nurses right now that I've worked very closely with that is right now at Grady Hospital, and they are having to be the nurse for a patient with coronavirus. And she's handling it just like the G that she is. She's going to make sure that she practice her standard precautions, and still love and respect that patient and make sure that she gives him the best care that I know she is going to do. So this video is well needed. I hope you guys really enjoyed this video. Let me know in the comment section, any nurses, if you had any experiences on, just anything that I've spoken about and anything that you have to add to nurses thinking about becoming nurses. I do believe that nursing is a wonderful field. I do love the fact that I am a nurse. Am I going to continue on with my education and become a registered nurse? I'm not sure, because I have a lot of other dreams and goals that I want to, do it myself. I feel like I've dedicated a lot of years into taking care of other people. And so I do feel that eventually I will branch off into a lot of other things. But for now, I am still a team nurse. I do love it. And I wish all of you well if you're thinking about going in, or all of my nursing students who are about to graduate this year. Congratulations. And just know that it has not even started yet. Thank you all. Please like this video if you enjoy it. Please comment, subscribe to the channel, and share this video. Send it to all of your friends in your nursing school, nursing class. I really appreciate you guys watching. Love you all, and always remember to be divine minded.